from the Cath Lab.
And I'm Jennifer from the Cath Lab, and we are going to discuss FNABs. You're probably wondering what that means. It's fine needle aspiration with biopsy. And Angel's going to show you the order set for that.
And these are done on thyroids and parathyroids. When the patient has a nodule, he'll biopsy it. And that's the order sheet.
So just keep in mind, you will need to give Chris an ultrasound a heads up when these are scheduled, so he can fit it into his scheduled times of outpatient procedures.
It should be scheduled with him also. Sometimes that gets overlooked.
Yeah, that's why I always...
Yeah, we always check with Chris and say, hey, you know about this FNAB coming up today at such and such a time.
This is also another procedure where you will use conscious sedation. You'll use your Versed and fentanyl. Make sure you pull your Romazicon and Narcan for these as well. The sedation is to be given per Harlin's order. Make sure you want to fill out the bottom of this order sheet just like you would the other one we were talking about.
It has the amounts, put the amounts in that you gave, so that way you have an order to give it.
Yes. You will need this handy dandy FNAB box. This is a box that it kind of runs through everything that's in there. The formalin.
Which is these.
Yes.
This is the formalin.
The Cytolite.
Which is this one.
You'll have the slides.
These.
Yeah, that's the little, yeah. And then
that's what the slides go in. These are the slides. We have a box of slides. This is all the stuff that you want to keep stocked in your box, and you bring that with you when you go into the room to do these.
You have your little specimen bag because you'll collect those specimens after the procedure's finished, and there's a pencil.
You need to write the patient's name and their date of birth and their medical record number on here, on the clean ones. When Dr. Harlin performs the biopsy, what he'll do is there's some slides already in his tray that are sterile. He's going to take what he wants on the slides, he's going to put it on his that's in his tray, and he's going to give it to you. You're going to take the one that's got the name written on it, you're going to hook them together and slide them like that, and then you're going to put them, there's little slits in this one, and they just sit right in the formalin. Yeah, they're easy to get into. Like that. Each one of these holds 6. Sometimes you'll use 2 or 3 of these, depending on how many slides he makes. And you put both of them in there. The one that he gave you and the one that you wrote on. He's going to do a core. He may do 2 or 3 core biopsies. Sometimes the core is actually on the slide he gives you, and you're going to use a little 18, it don't matter what gauge it is. I usually use a blunt, and I pick the core off, and it goes into this, the formalin. Thank you. It goes into the formalin. Sometimes he'll have the biopsy on the little piece of the core on the little needle he's using to get the biopsy, and he'll drop it in there. It just depends where it comes up. When he is finished, anything that's left in his biopsy tool that he uses, he's going to wash in this Cytolite. He's going to put the end of it, so you just hold it for him with the top off. He'll put his tool in there, kind of rinse it, and then he'll inject some air in it to get anything that's inside that needle in here. So you'll have the core biopsy, you'll have washings, and you'll have slides. After we're finished, I just make sure there's a patient sticker on each one. I put it in the little bag, and I bring it to the lab and tell them, we did an FNAB with Dr. Harlin. Here's the slides, the washings, and the core biopsies, and I give it to Alan usually, and he puts it in the computer for me, because I don't know exactly what all they put in the computer. It's more than just like a regular lab order.
For these patients, I told you to pull the Versed and fentanyl. Make sure before before you ever get the patient in the room and start the procedure, make sure you hook them up to the monitor and O2 as well, just because you don't have to you won't be fumbling, because during these procedures, he will require you to give sedation during the procedure. So as these poking these people in their thyroid and parathyroid, he'll be asking you to give them sedation. This will be done in a stretcher, so when you just roll the patient in the room, you just put that one arm down, and he'll perform this with the stretcher and ultrasound. You want to bring your specimens to the lab, like Angel said, and just let them know what you did, and they usually put that order in. So just kind of reiterating.
Yes.
And that is it.
That's it for those.